They funded an army of psychiatric institutions across the United States and Canada to perform experiments on unsuspecting patients using psychedelic drugs, sensory deprivation, electroshock treatment, and more. The program was known by its codename, MKUltra. At the end of the Korean War, a number of freed American POWs came home seemingly brainwashed and espousing communist propaganda. American officials suspected that the soldiers had been subjected to what they thought were new communist mind control techniques. Alarmed by the situation, the newly formed CIA allocated $25 million for psychiatric experiments on human beings.
It was the most secret program ever conducted by the CIA in the United States. Patients at psychiatric hospitals, prisoners in federal institutions, and even people in the public were given drugs without their awareness or consent and experimented upon.
Initial projects within MKUltra included Operation Midnight Climax.
They established what were called safe houses, where prostitutes would lure men to these apartments. And then once the men were in the apartments, they were dosed with LSD. And then they were basically studied by CIA scientists, usually behind a two-way mirror.
Another common practice was the hosting and observing of LSD-induced parties with live music. These parties were called acid tests, and the culture that grew out of them played a key role in the development of the hippie and psychedelic movements a few years later. However, some of the most damaging experiments occurred at the Allen Memorial Institute in Montreal, Canada. There, under the direction of infamous Scottish-American psychiatrist Dr. Ewan Cameron, unsuspecting patients, many of whom had common ailments such as postpartum depression, were experimented on with aggressive drug cocktails and extreme techniques.
My father was a victim of Dr. Cameron. He was a 27-year-old, healthy skier, canoeer, very athletic, and he had asthma. They told him if he went to the Allen Memorial, they could cure his asthma.
My father, Charles, was a patient of Dr. Cameron's. He had a trigeminal neuralgia, it's called, where there's a pain in the temple that radiates into the jaw that apparently is excruciatingly painful. They told him that it was psychosomatic, which it's not, but in those days, what did they know? So they sent him to a shrink. This shrink that he went to was working with Cameron, although we didn't know. So he put my father right into the program.
I was having trouble with my parents. My father and my stepmother decided to put me in the Allen Memorial Institute. They had no idea what went on in there. I was 16 when I was there.
Dr. Cameron pursued a concept he called depatterning, which was meant to reduce patients to an infantile psychological state wherein doctors could take advantage of the person's cognitive vulnerability to attempt to rebuild their mind under the doctor's control. A popular method of choice to achieve this was called psychic driving.
The day that my father was brought to the hospital, they immediately put him on insulin to put him into like an insulin coma. They took